Hi everyone, I'm Leslie Cockrum here with a brief COVID-19 update. As you've likely heard, there's a new COVID-19 variant called Omicron that is making the news and the headlines. As we've talked about before, this is expected to see more and more variants come up as we know viruses mutate easily. I also expect that this won't be the last variant we'll see. We'll likely make our way down the Greek alphabet. So what do we know about this COVID-19 variant? Well, Omicron, as it's called, was first identified in South Africa and Botswana earlier in November. We've since identified it in multiple countries, including our own, and currently we've seen it in several of our states. I expect over the next several days that we'll continue to see more cases and in more states. Now, one piece of good news is that our current tests can identify Omicron. And our state laboratories have the ability to sequence the virus, which is how they can identify when Omicron cases are being seen in their state. So why do we worry about these new variants? And why is Omicron such a variant of concern, as they say? Well, one of the major issues with Omicron is just the number of mutations it has and where those mutations occur. Whenever there's a new variant that comes on the scene, we ask ourselves a few different questions. One, is this new variant more easily transmissible or easily spread from person to person? We saw this with the Delta variant, that it was more easily transmissible, and that's why it's become the dominant variant that we see in our country. We have some preliminary data that seems to suggest that Omicron does spread easily, but it's going to take days to weeks to even months to really figure this out. The second issue is whether this variant causes more severe disease or even death. Again, this is something that it's going to take some time to really sort out. So far, in many of the cases that we've seen in South Africa and even the few cases here in the United States, they've all had mild disease. But again, this is an area that will be actively watched. The last part is how well will our vaccines work against this variant? Given the number of mutations and again where they are, it is likely that the vaccines won't work quite as well as they do against our current variants. This means that, again, people who are fully vaccinated, as we've already seen in some of the cases in the US, can potentially get Omicron. However, again, we know that our vaccines are really good at protecting us against severe disease, including hospitalization and death, which is obviously very important. And we expect that this vaccines that we currently have will also provide some of that protection against Omicron too. Again, more and more that we will learn about Omicron in the next weeks to months ahead. So what can we do now and how does this affect us? Well, as we've talked about, we have to find this balance with COVID because it's not going away between being safe and being smart and living our lives and continuing with the work that we do, our goals, those kinds of things. So we have to find that balance. Main ways that we can protect ourselves is one, to get your booster. If you haven't already done so, go ahead, get that done before the holidays, because again, the boosters will certainly help protect us and hopefully prevent transmission, but certainly severe disease and death. Also, if you've got family, friends, loved ones, neighbors that haven't gotten vaccinated again, please encourage them to do so. Help them find reputable sources of information. My two youngest children are getting their second vaccine tomorrow, which I'm really excited about. So again, vaccination is going to be key to helping us overcome this. The last part is masks. Masks are still really, really important. Please make sure you're wearing your mask at all times when you're at your Vivent Health facilities, unless you're eating or drinking, but masks are really important. Even if it's just you in your cubicle or you're in the back workroom with the other vaccinated champions, again, masks are so important. I also wear my mask whenever I'm indoors in public areas like grocery stores, libraries, those kinds of places. So please send any questions that you might have to the COVID-19 email. I expect again that we'll have more information in the days to weeks to come, and we'll certainly share that with you. But keep up the great work and have a wonderful weekend. Thank you.